CPR stands for cardiopulmonary resuscitation. This essential skill can be the difference between life and death in critical situations. It is a life-saving technique used when someone's heart stops beating. Immediate action can significantly improve the chances of survival. CPR helps to keep blood and oxygen flowing to the brain and other vital organs. This continuous flow is crucial to prevent brain damage and keep the person alive until professional help arrives. Learning CPR is very important. It equips you with the knowledge and confidence to act swiftly in emergencies. You never know when you might need to use it. Emergencies can happen anytime, anywhere, and being prepared can save lives. It could be a family member, a friend, or even a stranger. Your ability to perform CPR can make a significant impact on someone's life. Knowing CPR gives you the power to make a difference. It empowers you to take control in critical moments and provide essential aid. By acting quickly, you can double or even triple a person's chance of survival. Every second counts, and your prompt response can be life-saving. It is easy to learn CPR. With proper training, anyone can master the basic steps and be prepared to help in an emergency. Many organizations offer CPR training courses. These courses provide hands-on practice and certification, ensuring you are ready to act when needed. If you see someone collapse, first check if the scene is safe. Ensure there are no immediate dangers like traffic, fire, or falling debris that could put you or the victim at further risk. Then check if the person is responsive. Tap them on the shoulder and shout, "Are you okay?" To see if they respond to your voice or touch, gently shake their shoulders and ask loudly, "Are you okay?" If there is no response, it's crucial to act quickly. If they don't respond, call 911 immediately. Inform the dispatcher of the situation and your location. Next, check for breathing. Look for chest movement, listen for breaths, and feel for breath on your cheek. This will help you determine if the person is breathing normally. If the person is not breathing, start chest compressions immediately. Time is critical in these situations. Position yourself over their chest, with your arms straight and shoulders aligned. This ensures that your compressions are effective. Place one hand on top of the other, interlacing your fingers. This grip will help you apply the necessary force. Push down hard and fast in the center of the chest, at a rate of 100 to 120 compressions per minute. The depth should be about 2 inches. Continue chest compressions without stopping until help arrives. If you become tired, try to find someone to take over for you. Remember, your actions can save a life. CPR for children and infants is similar to adult CPR, but there are a few key differences. Understanding these differences is crucial for effective emergency response. For children, use one hand for chest compressions. This technique ensures that the compressions are effective without causing injury. For infants, use only 2 fingers. This is because their bodies are much smaller and more delicate. The depth of compressions is also different. Proper depth is essential to ensure blood flow to vital organs. For children, compress the chest about 2 inches. This depth is sufficient to create the necessary pressure to circulate blood. For infants, compress the chest about 1.5 inches. This shallower depth is appropriate for their smaller size. Always remember to call for help first before starting CPR on a child or infant. This ensures that professional medical help is on the way. If you are alone, give 5 cycles of CPR, which is about 2 minutes, before calling 911. This initial effort can be critical in stabilizing the child or infant until help arrives. Safety first, protecting yourself and the victim. When performing CPR, it is important to take precautions to protect yourself and the victim. Always make sure the scene is safe before approaching the victim. If possible, wear gloves to protect yourself from bodily fluids. Do not move the victim unless they are in immediate danger. If you are not comfortable performing mouth-to-mouth resuscitation, you can provide hands-only CPR. The most important thing is to do something to help. Expert advice tips from healthcare professionals. Healthcare professionals emphasize the importance of early CPR and defibrillation. Early CPR helps to keep blood flowing to the brain and other vital organs. Defibrillation is a procedure that uses an electrical shock to restart the heart. If you are in a public place, look for an AED, or automated external defibrillator. AEDs are easy to use and can greatly increase the chances of survival. Remember, even if you are not a medical professional, you can make a difference in a life-threatening situation.